Despite modern advancements of medical technology, women's health still remains a serious challenge globally. Taking 800 lives every single day, maternal mortality is one of the leading causes of death in women.
99% of these deaths are occurring in developing countries. That means that if there is poor socioeconomic status of the country, we are going to lose mothers.
In Pakistan, the situation is no different, where 3 women die every 2 hours from pregnancy or childbirth-related complications. Greater numbers still lack access to quality reproductive care and effective family planning services. Maintaining the current momentum is not enough to meet the Global Sustainable Development Goal for maternal mortality reduction.
For this purpose, White Ribbon Alliance globally has launched a campaign, What Women Want. And through this campaign, we are aiming to reach 1 million women to seek their views and opinions about what would they like to have in terms of quality, equity, and dignity of healthcare for every woman and every girl globally.
In Pakistan, What Women Want campaign was launched in the partnership of various organizations. It includes the Rural Support Network program, which works in entire Pakistan. In addition to this, we also partnered with other organizations working on the women empowerment, and they collected this information from Balochistan and districts of Sindh. For urban areas, we partnered with the Fire Communication, and Fire Communications collected the needs of the urban women. They went to various universities and colleges of the urban cities and asked the one demand from each woman and girl.
During the surveys, we identified the stories of women champions, and to record these stories, we went all across the provinces and we met them. We met the champion women at their houses in far-fetched villages and rural areas. We met these women, we had meetings with them, we sat with them at their houses, their families, we met their children, and we heard their stories from them.
In Pakistan, the campaign reached not only to the women of far-flung rural areas, but also motivated influential women sitting in power corridors who voiced their concern on women's equitable access to basic healthcare facilities.
We have to work out on this, and we have to make sure we provide all the basic requirements and all the basic necessities that are required for every woman.
If the professional people will be there, they can help them. They can help them not to die.
Every child which is born is out of a mother. So the society needs to recognize the position of a mother.
Parliamentarians also stressed the need of respectable care from healthcare providers.
जब एक खातून हॉस्पिटल में जाएं तो अगर वहाँ पे जो मौजूद अमला है अगर उनका बिहेवियर अच्छा हो तो कहते हैं ना मरीज़ की आधी बीमारी तो उस प्यार और मोहब्बत से ही कम हो जाती है।
ये सबसे ज़्यादा ज़रूरी है कि स्टाफ जो है बाअखलाक हो और फुल ट्रेन हो और वो अपनी बातों से अपने अखलाक से इतना मुतासिर करे कि वो अपनी आधी तकलीफ भूल जाए।
Untrained birth attendants and unhygienic sanitary conditions are yet another concern highlighted by lawmakers.
There should be a proper reproductive health clinic where there are qualified people who explain to the women about reproductive health, about birth control, about hygiene.
It's our job also as parliamentarians and the state actually. The state is responsible to provide all facilities to these women at the far-flung areas.
हॉस्पिटल तो ऐसी जगह है कि वहाँ पे जाके आपको बीमारी को ख़त्म करना है, लेकिन यहाँ पे आप देख रहे हैं कि उल्टा बीमारियों को लेके आते हैं। तो ये तो हेल्थ के हवाले से मैं कहती हूँ कि बहुत ज़रूरी है कि इनको क्लीन एनवायरनमेंट दिया जाए।
ऐसी बहुत सारी ख़वातीन हैं जो ज़चगी के दौरान इस दुनिया से चली जाती हैं और ये एक बहुत बड़ा नुकसान है उस ख़ानदान का भी और पूरी कौम का। तो इस वक्त हुकूमती सतह पे भी जिस तरह से करीब हॉस्पिटल्स और तमाम सहूलियात वो होनी चाहिए।
During the campaign, special attention was also raised towards lack of privacy and a great number of stillbirths still being registered across labour wards.
खातून एक लेबर रूम में लेटी हुई हैं और डिलीवरी उसकी हो रही है और मेल स्टाफ खड़ा हुआ है, तो ये इतनी बड़ी तौहीन आमेज़ एटीट्यूड होता है। लेकिन हमारी इंतज़ामिया को, हमारी हॉस्पिटल को, हमारी गवर्नमेंट को ये चीज़ जो है ना तवज्जो देनी चाहिए।
Women and children are the most vulnerable in this society. They are not privileged as the way they should have been. So Prime Minister's vision is to give them the best healthcare facilities in this government, inshallah.
That's not all. Young women and girls also raise their voices and want government and all stakeholders to listen to their demands and build an agenda to prioritise their health.
Women and children, they are a very important part of the population and they should be given free health services. For the current government, it's very important to start free health services for maternal and child health.
There should be separate seating areas in waiting rooms for women in hospitals.
Let every woman have quality and respectable reproductive health care services in Pakistan.
The What Women Want campaign will help to place the spotlight on demands raised throughout the campaign by women from all walks of life.
We have established a data entry cell at our office of the White Women Alliance, where we are entering this information and compiling a report. This report will be shared with the policymakers and the government stakeholders, and we will try to convince them and advocate with them to include the needs and demands of the women into future programs regarding the maternal health.
And once this campaign is completed and concluded, we would have this data available with us, which will be shared globally with the global community to make resources and mobilize resources, making it available for these women and girls wherever they are living.
White Women Alliance Pakistan has been the voice of women with respect to their health in Pakistan for last more than a decade time. It has contributed towards policy reforms and bringing the issues of the women health to the policy makers right from the rural areas of far-fetched communities in Pakistan to those who are sitting in the parliament, in media, in entertainment, education, academia. So in this more than a decade journey, basically White Women Alliance has redefined safe motherhood from a movement to a voice of women in Pakistan.
As far as this White Ribbon Alliance is concerned, I'm delighted about it, and I sincerely hope that the government will cooperate with them and make it easier for them, and there will be less red tapeism and the work moves fast.
White Ribbon Alliance campaign will not only bring also create a social awareness around that issue, but also will put some pressure on the state and the health ministries and health departments to really prioritize women's reproductive health care.
Let every woman have quality and respectable healthcare facility.